Well, it's some 12 minutes after 8, and you're still watching the AM show. We're live here on the Joynews channel, and our show is proudly brought to you by Mixie Coffee. Well, some news coming in, and I want to share it with you, is that David Moyes, who is the manager of Manchester United in England, has been sacked. And already we're getting a lot of reactions from Facebook coming through, and I'll share a couple with you. But just to read to you a little bit about some reactions in England as well. Okay, so in the meantime, Ryan Giggs is taking over. Ryan Giggs is still, he's a player coach, and he's taking over, but David Moyes has been sacked. And some reaction in on Facebook just quickly on this, just before we continue. But we'll be talking about insurance. I'm sure you've heard by now, effective 1st April, there was a directive that took effect. No premium, no cover. I don't know how that is affecting you. We're talking insurance in general with the director of the Ghana Insurance College, Justice Yao Ofori. But in the meantime, the news I'm sharing with you is that the manager of Manchester United, David Moyes, has been sacked. And of course, I will share with you reactions on Facebook, but let's get the discussion underway. We're talking insurance now. Mr. Justice Yao Ofori, good morning to you, and thank you so much.
Good morning, and morning to your great viewers.
So how is the no premium, no cover policy going?
So far it's doing well. It took effect 1st of April this year. The idea is that if you don't pay your premium, you don't get insurance protection. Yeah.
So how was what was happening before, where payments was made rather flexible for the client? How was it affecting the companies?
Yeah, the idea of making payment flexible is always a good idea, but it was actually affecting the insurance business. This was because most of the insureds were not paying their premiums. Insurance itself is not supposed to be on credit basis. You have to pay, and then the insurer would have to invest the monies that you've paid as premium and then get returns from investment.
Okay.
And based on that investment, they can now be equipped to pay claims, legitimate claims. So that was the practice, but most of the insureds were not paying their premiums. It was affecting the insurance business.
Whose fault was it?
I'll blame the industry itself. I think it came out of competition. Competition amongst themselves made them do illegitimate business. If you issue policies on credit and there's no money available, then you cannot pay claims that you have to pay. So that was the problem. So I think with the introduction of no premium, no insurance is going to make the insurance companies more solvent, financially capable of paying legitimate claims. So it's good news for the insurance industry. It's also good for the insured. Really, is it? Yes.
Because if it was made flexible for us to pay, and now because of the directive we have to pay one time, I don't think it's good news necessarily for us.
It is good news, because imagine if you were getting insurance on credit and people were not paying their premiums. It means the insurance company wouldn't have had the money to pay legitimate claims. So a legitimate claimant will not have money available to be paid to him or her, and that to me would have been a bad example.
Would it also not get people away from insuring comprehensively, because that is more expensive?
Yeah, it is expensive, but nothing is free. You have to pay for the services you are going to get. It happens everywhere in the world. Insurance is never on credit. You have to pay before you earn insurance.
But the cost of insuring, I realize that it's not a flat rate for all the insurance companies, so that you can get it cheaper or higher somewhere else. Is that what it's supposed to be? Shouldn't we have, you know, like a fixed rate for all insurance companies?
No, it doesn't work that way. Just like any other product, you would like to buy, let's say, a Toyota vehicle. If you go to Japan Motors, it might be different from maybe another company. Everybody has got their overhead costs, where they got their source from, cost of doing operations. So, and then the content of the policy, maybe you are getting more value for your money. So these are some of the factors that bring about the differences in prices.
But is insurance really necessary? I mean, well, vehicle or health?
Yeah, insurance is necessary, especially to the poor person, not even to the driver of the vehicle. If you look at a pedestrian walking on the roadside, gets hit by a vehicle, and the driver of this vehicle is so poor to actually take care of the medical costs, the pain and suffering, you need a strong financial entity to rely on, and that is when insurance comes in. You, the insured as well, you probably, no matter how rich you are, you probably wouldn't have money sitting down to deal with emergencies. So if you have insurance, it gives you peace of mind, and you fall on them, and they will deal with the situation.
So with what you said, I just want you to tell us what the difference is. Premium and third party. When you're making claims, what's the difference?
Okay, you're talking about the third party and then the comprehensive.
Comprehensive, yes.
Yeah. The third party basically means that you are insuring a third person. In insurance, we have the first party, that is the insured, and then we have the second party, that is the insurance company.
Okay.
And then anyone who makes a claim against the policy that you have is called a third party. The other name for the third party is also called liability insurance. So third party, another name for third party is liability, because the person who is making the claim is not the person who the policy insures. He comes in because you are liable, he sees you as being liable for his injuries or damage or death.
Okay, so let's say I'm a driver, and then I hit somebody else's vehicle.
Yes.
What does it mean if I have a third party?
Yeah, if you have a third party, it means that your insurance company would take care of
the other person, and not me.
And not you.
Okay.
Yeah, up to the policy limit. Now, if you have comprehensive, then the insurance company will take care of, and you are at fault. Yeah, the insurance company will take care of the third party as well as your vehicle. You getting me? Subject to what we call deductible or excess. That means there's a portion of a claim that you have to pay whenever there's a loss. You, the insured.
You know, I get the sense that people don't really trust the insurance companies. You are the college. What kind of feeling do you get?
Yeah, it's people. Anytime you tell someone you work in the insurance industry, they think you are probably you're a con man. They think insurance people are quick to accept premiums, and when it comes to payment of claims, they drag their feet. The idea is that when there's a loss, even if the policy it's in force, insurance companies don't just pay losses. They would have to investigate to confirm liability and then the extent of damage.
Yeah, but when they're convincing you, you know, to insure with them, they don't tell you all these things.
Yeah.
You know, they say we will pay promptly, we are the fastest, we're quick, we're that, and then when the thing happens that you really need them, then they tell you all the administrative processes they have to go through.
Yeah, the insurance company will be there to address your concerns. The problem we have as insureds, including me myself being an insurer, is that we don't read our policies. We go, we buy the policy, we buy the insurance, we have the policy, and we throw it somewhere. The only time we go and look at the policy is when there's a claim and we want to know. Yeah. So I think the problem falls on both the insured and the insurer. Lack of education is one of them. But I think when we buy our policies, it's good we read them. Yeah.
So we're also talking about your graduation, which is on Friday. But okay, so let's just talk about the graduation. Then I'll ask you certain questions. For instance, I want to know if I graduate from the Ghana Insurance College, where can I work? Do I have to necessarily work with an insurance company? But first of all, how many people are graduating on Friday?
On Friday, we have about 152 of our graduates. We have people graduating at the certificate, diploma, and advanced diploma levels.
Okay.
Yeah.
How competitive is the institute?
So far, I would say we have some minor competition within Ghana. Our college is the sole professional institution when it comes to insurance in Ghana. We have some universities providing academic education in insurance, but most of them do not lead to any exemptions towards the professional designation. We have competition from other West African countries like Nigeria. They also have an insurance college, and then the West African Insurance Institute in Gambia, which is owned by the English-speaking West African countries. they do a similar thing that we do here.
Okay. So these are the people that you are directly competing with?
Yeah, they are direct competition, yeah.
Okay, okay. Is it difficult getting into the college?
Yes and no. Once you have the qualifications, academic qualification, you don't have a problem.
So what do you look out for?
Yeah, we look at your educational background. You have a degree. If you don't have a degree,
it should be a degree in anything.
Yeah, it doesn't matter. If you have SHS with 4 passes, including English, even if you don't have any of these, and you're academically smart, and you have attained the age of 18. At the time of enrollment, you can enroll into our diploma.
Okay.
The idea is that it's not everybody who has. When we went to school, there were people who were academically good, but they couldn't pursue education further, so they dropped somewhere along the line. So professional programs give them the option to also find a future. So once you are academically good, but you don't have this, but you've attained the required age, you can also enroll.
Is there a ready job for you after graduation? You know, you have over 100 people graduating on Friday.
Yeah.
Do we have waiting jobs for them?
I don't think anywhere in this world you can say there's always a waiting job somewhere, but it makes your prospects promising. The way insurance education is going, if you don't have at least the basic like diploma in insurance, it's really going to be very difficult for you to enter the insurance industry, or if you are already within, to move up the ladder. So it's actually very important for those who want to pursue insurance as a career.
You know, I can count the number of insurance companies we have in Ghana. When you graduate from the college, can you only work with these insurance companies because they can absorb very little?
No, insurance education or the practice of insurance is not only limited to insurance companies. We have bank assurance, we have banking institutions with our insurance departments. When you go to the factories, the big companies like Tamawa Refinery, Shell, Total, Coca-Cola, these big companies have insurance departments which are not being managed by professional insurers. In the developed world, such departments are managed by risk managers. So insurance education is not limited to working only in insurance institutions, but insurance is all over. Even at Multi-TV, I think you have a big portfolio, and maybe it's not even managed by, maybe it's managed by a finance manager who is not insurance oriented. So there are opportunities for insurance trained personnel anywhere in the country.
So how important is health insurance?
Well, health insurance,
because you know, sometimes when you are sometimes when you have the insurance, when you have the private insurance, you get the attention that you get is not the same as when you have the public insurance. Are they not supposed to be on the same level?
Yeah, I think they're supposed to be on the same level, but I don't know maybe the challenges that leads to that. Maybe it could be the payment for services that they have rendered. If it's delayed, it also affects the services that clients or patients would receive. But health insurance, for me, it's important, just like any other insurance. It's not everybody who is financially capable of paying medical expenses when they when they sustain any injuries or are suffering from any ailment. So insurance, just like for vehicles being important, the life itself or the health is very important, and I think we should look into that. We should take it very serious.
Okay. So the salespersons of insurance companies, those who go out, are they supposed to be telling you exactly what the policies you're signing on to, you know, the positives and the negatives? Because it looks as if they sell only the positives. Is this something that you teach at the college?
Yeah, we have a certificate program at the college that is actually meant to equip sales and marketing force of the industry. But I think we need some legal backing to compel people to come for such training. Yes, the sales agent is supposed to explain what you are buying to you, so that you actually appreciate what you're buying.
They don't always do that.
Yeah, I think that will be as a result of lack of education on the part of the sales force. So maybe with the backing of maybe the commission and support from the major insurance companies in the country, we can look at it and encourage such agents to at least attain our certificate designation.
Is insurance supposed to be expensive?
Yes and no. For example, if you have a comprehensive coverage, it's going to take care of your liability to someone and then your vehicle. So it means you are going to gain more from the insurance company. So you will have to pay more. It also depends on the vehicle, for example, that you are insuring. If you are insuring a low-price vehicle, comprehensive, you pay less than someone who is probably insuring his Mercedes-Benz or BMW or Hummer. So the more you ask, the more you pay. Also, insurance can be cheap if it's for, let's say, micro-insurance. We have something called micro-insurance, which is being now introduced into the system. That is for low-income earning families. They pay lower premiums. The sum insured or the benefits when there's a loss is also minimal. Administrative cost is also minimum. So the overhead cost is also minimum. So that is a form of, I would say, a reasonable insurance. For me, nothing is cheap. What we call cheap or reasonable could be expensive to someone, depending on his status.
And I'm thinking that if you don't make claims for a certain period and you stick with the same insurance company, they should be able to refund some of the monies to you, because you're making an investment. You're not claiming. They shouldn't, because I feel that the insurance companies are very rich. A lot of people don't make claims.
Oh, I see. I see. Very interesting.
Oh, you don't see it the way I see it.
I don't see the way you see it, but let me explain something to you. Also see a situation whereby you enter an insurance company, you buy a policy. The moment you step out of the insurance company, you run into an accident, which is your fault. You pay the premium of, let's say, 100 cedis. Now the insurance company is going to incur an expense of, let's say, 20,000 or 40,000. How do you see that? The idea of insurance is for people to put their monies together into a pool. It's like a communal thing. Each person helping the other. And we expect that those who put in money into this pool will be more than those who take out.
Okay.
So that there will always be money there to take care of the unfortunate people.
Okay.
So your premium is helping pay someone's losses. Next time it could be your turn and someone's one will help pay yours.
Okay. So what exactly is going to be happening on Friday?
Friday we're having our 7th graduation. The Ghana Insurance College actually came into existence in 2006. It's the educational backbone of the insurance industry. It's owned by the principal stakeholders, namely the National Insurance Commission, the Ghana Insurance Association, the Ghana Insurance Brokers Association, and the Insurance Institute of Ghana. These founding fathers at the time realized that we didn't have enough insurance professionals on the market, so they put their resources together to establish the college. We've been going through graduation for the past 8 years. This is our 7th graduation, and it will be held at the College for Surgeons and Physicians.
Okay.
I think I got the name right, yeah. So we hope you'll be there.
Yeah, we will.
See us,
what time?
It starts at 9:30 and we should be done by 12 noon.
Okay.
Yeah.
All right. I'd like to say thank you to you, Justice Yaofori, Director of the Ghana Insurance College. Thank you so much for being here this morning.
Yeah.
Thank you for the education on insurance.
And thank you for your time.
All right.
Have a good day.
All right. So just to go over quickly, Manchester United has sacked David Moyes. Ryan Giggs is to take charge on interim basis. Moyes' backroom staff have also left, and Old Trafford Club announced this decision this morning, this Tuesday morning, and people are getting interactive on Facebook. Just a couple of the messages. Pius says this simply means more problems in the camp of Manchester United. Ejeyo Ususamoa says thanks be to God. And Al Hassan Sumani Jr. says sorry for him, you will continue to just be losing. Shameful attempts. Okay, Abraham Onyekachi says the worst is yet to come. They would have had little patience. Okay, Frimpong says, oh, they should give him more time before. Amos Ado says same old story. So different comments on Facebook. You can get interactive. Just go to facebook.com facebook.com/Joynews on TV. Okay, so another issue that's been trending, sadly, is the seaweed that's threatened some of our coastal life. And a very strange and pungent waterweed is threatening the coastline and aquatic life of some beaches in the capital. Residents along the coast say the brownish substance, which surfaced about 2 weeks ago, is posing a great threat to their businesses, since very few people now patronize their services along the coast. That is my banner, which is up next.